So the standard of care in therapy with polycythemia vera has been phlebotomy, aspirin therapy, and cytoreduction with pharmacological agents in the appropriate patients. So far, hydroxyurea and interferons have been the cornerstone of this therapy. There's been improvement on interferon formulations. So in addition to the non-FDA approved pegylated interferons that have been used off-label for patients with polycythemia vera for years, such as the brand Pegasus and Ropeginterferon. There has been a novel, longer-acting monopegylated interferon, Ropeginterferon alpha 2b, which is been studied in clinical trials in polycythemia vera, predominantly in Europe, showing superiority to hydroxyurea in first-line setting. This agent has completed their phase 3 studies and now awaiting approvals for clinical use in patients with myelofibrosis. We look forward to having an FDA-approved long-acting interferon for our patients for the future. It's not yet available for commercial use in the US. Additional agents are being evaluated in a first-line setting and beyond. A unique agent that has been studied, and particularly actually a class of agents, are the hepcidin inhibitors. So hepcidin inhibitors can result in dissociation between iron storage in the body and erythropoiesis, allowing to reduce the frequency of therapeutic phlebotomies that patients will require. And that can be an add-on therapy to whichever active therapy the patients are on. So for patients on phlebotomy only, that could be their only modality of therapy, but it also can be combined with hydroxyurea or interferon or ruxolitinib. So this is an agent that was presented in previous meetings, and data has been very promising. And now a phase 3 study is being designed to investigate the combination of this agent to the standard of care therapy in patients and whether this can be of clinical help and utility in all patients. Beyond first-line therapy, ruxolitinib is FDA approved for this indication. It's a JAK2 inhibitor that is also approved for myelofibrosis that has the unique effect of lowering erythropoiesis and is a very active agent with safety and durable benefit in patients with myelofibrosis with polycythemia vera beyond therapy with hydroxyurea. Other agents being investigated is the unique inhibitor givinostat. This is also in phase 3 studies, and we look forward to hear more about it in the future.